Kia ora koutou, ngā mihi mahana ki a koutou katoa. Ko wai au, ko whiri te manga, ko Hokianga whakapau karakia te moana. Ko Ngāti Kurukuru, ko Ngāti Whārana me te pauka ngā hapū, ko ngā pui te iwi. He mahi ana hau, he aho rangi o Hauora Hokianga. Nō reira, tēnā koutou, kia ora koutou katoa. My aspirations for my whānau and for mokopuna is that every whānau has a kaimahi hauora who live and breathe a kaupapa, and there are so many opportunities in the health sector that I feel that our whānau of the future need to be part of that. Māori at senior levels in decision-making roles in entities across the health sector, and increasing our current 6 to 10% of our Māori health workforce to at least 25% of our health workforce. Māori Niwi providers that are at the forefront of healthcare in Aotearoa, New Zealand, and thereby reducing health and social service inequalities. I'm mindful of Matua Ranganui Walker's book, Whawhai Tōni Mātou, Struggle Without End, and in terms of addressing inequalities is an ongoing issue for us as whānau, and the current New Zealand health and disability reforms is a great opportunity to achieve these aspirations. So the priorities over the next 25 years are increasing the investment in health and strengthening our Māori iwi providers, increasing our workforce who are culturally competent, and that's our workforce in terms of our iwi Māori workforce, as well as our general workforce, and equity of access, equity of investment, and equity of voice and decision making. If I reflect on the past decade in terms of what we've achieved thus far, I'm thinking about some fantastic Māori health workforce initiatives such as Ngā Manukura o Apopo, which is a Māori nursing and midwifery program, thinking about the Otago Māori health workforce development programs, the range of programs that provides in supporting Māori workforce development, the Māori nursing schools that have been developed over the past 10 years, Te Wānanga o Aonuiarangi, Whitireia, and Manukau Institute of Technology, some great programs that have been created. If I think about senior nursing roles that recently at the Ministry of Health that have been occupied by Māori, Te Ropu Whakakaupapa Urita, Māori clinical leadership that was created to address and support the response to COVID-19. These innovations and these opportunities that have been developed, we can build on those for the future. If I also think about the acknowledgement of the inequities and recommendations as the outcome of the Y2575 report, we're in such a permissive environment, and that's not about being given permission, that's actually about our ability to openly discuss, to challenge and create change in respect of Te Tiriti o Waitangi. It's a great opportunity to hear the Māori voice at the decision table and true honouring of Te Tiriti. And I reflect on a comment a kuia made recently in regards to the upcoming changes and reforms in the health system, that it's a way to hear the Māori voice in the decision making, and this development of the Māori Health Authority as an example should not be seen as a threat to anybody. It's such a great opportunity for us in terms of being at that table and developing solutions that are responsive to Māori and improving health outcomes. So we haven't seen, to my extent of being in the health sector for 30 odd years, I don't see we've seen previously the level of commitment to addressing inequalities. So we're at a time of change, we're at a time that's really exciting, and I'm really optimistic about the future. The changes that will be occurring in the next 25 years, we of course need to work collaboratively. And we need to look at how we can change and evolve in the development of the new look health and disability reforms. I believe that we can't be precious, we must not be precious though, and while recognising mana motuhake, we need to ensure that we're all working together collaboratively without actually compromising the advancement of the collective. What I mean by that is I see often too many entities that take the lead on initiatives and leave people behind in the process, i.e. smaller providers who are part of the collective are left with the crumbs and in order to do the great work that they do. So in terms of that collaborativeness and working together, it is about that, about collectively doing so. I think we also need to be cautious with the establishment of the Māori Health Authority, that we cannot, or for instance, Health NZ cannot abdicate responsibility that it's someone else's problem. So I also think we need to reframe the kōrero, because what I've seen recently is around we need to actually challenge the power relationships, and there's been recent reference to the Māori Health Authority as sitting alongside Health New Zealand. Now that in itself is, I appreciate the structure that's been developed, but the rhetoric exists where Māori is seen as an addition or an add-on. This commentary reeks of patriarchal structures where the less dominant needs to be supported or who can out-lead. We have the ability to lead. We have great Māori leadership in this country, in Aotearoa, that we can take the lead. We can take the stronghold, we can actually lead out and not be sitting alongside another entity that is seen as a more dominant structure. The Māori Health Authority, as I said, is not a separatist. It's a reflection and assertion of tino rangatira, of self-determination and of mana motuhake. And in the context of manaaki and iwi and our Māori health providers, they've never been developed to be exclusive, so that the services are for everybody. So the collaborative nature of what we can achieve in the next 25 years and Māori Crown partnerships looks just like that, in terms of working together collaboratively, not one superseding the other, but actually having an equal voice at the table in decision making.